Hello, I am Elizabeth Cooley, and welcome to my presentation of how the coronavirus pandemic impacted the Marshfield Clinic Health System Family Health Center dental centers. In the middle of March of 2020, the coronavirus became a global pandemic, and the world seemed to be shutting down unless you were considered an essential business. Since dental, which does not include dental emergencies, is considered an elective area, the 10 dental centers within the Marshfield Clinic Health System shut down. Each clinic temporarily laid off all employees except the manager, assistant manager, and 1 to 2 appointment coordinators, depending on the size of the area served by the dental clinic. At the clinic I work at, we had 21 employees, and of those 21, 19 were laid off. Slowly, over the course of the next few months, each clinic started opening back up, starting in the busier areas that were served. For example, Chippewa Falls, a large city, opened first, and Park Falls being one of the last to open. In May of 2020, Park Falls Dental opened up and was rotating the 3 dentists 1 week at a time. At that point, about 8 people were brought back to work. However, only dental emergency patients were being seen. Then, in June of 2020, slowly the rest of the employees came back, and regular appointments, non-emergencies, and hygiene appointments were able to be scheduled. Since the clinic has opened up fully, the Marshfield Clinic Health System has been trying to find ways to combat some issues that the coronavirus pandemic created for the health system. The Iron Triangle method was first created in 1994 by William Kissick, and his goal was to address these issues. The Iron Triangle of healthcare can be used to help address the issue of access, cost, and quality issues that have been created. However, according to the Iron Triangle method, each issue has to be addressed separately and not at the same time. For example, when access is improved, typically cost results would decline. Due to the coronavirus pandemic, Marshfield Clinic Health System took a large hit when it came to finances. One of the new costs that has financially affected the health system is the increased amount of personal protective equipment that needs to be used to help keep patients and staff members safe from different types of viruses and bacteria. This has also increased the cost that it takes to purchase the new PPE. Pre-COVID, 1 dental coat was being used during the day, and level 3 masks were being used during patient care. Post-COVID, dental coats are being changed after each procedure, and N95 masks are required during procedures. Another negative effect of the COVID-19 pandemic was that each clinic was short-staffed because it took a few months of trying to bring patients back, bringing staff back, the stimulus payments for those on unemployment decreasing, an extra amount of money being given. Staff members needed to start finding new jobs. Therefore, they quit the dental center, and additionally, staff members could not come back to work when called back, which was considered quitting, due to not having child care, because most child care facilities were still closed from the pandemic. Now that everything has opened back up, child care is not as much of an issue anymore, but the dental clinics are still short-staffed from those employees who quit. Lastly, an effect of the pandemic is that the dental clinics are not able to see the same number of patients they were seeing pre-COVID. According to the Centers for Disease Control and Prevention and the American Dental Association, operatory rooms need to settle for 30 minutes after the patient has left the operatory room and before the dental team can clean said operatory room to let the particles and aerosols to drop. This, in addition to the short staffing, has created an issue of the dentists not being able to see the same number of patients they were seeing before the shutdown. Finding solutions to the effects of the pandemic can be found by utilizing the iron triangle method that I explained earlier. To try and combat the increased costs from the new personal protective equipment that is being used, the dental clinics can try and purchase more lab coats that can be washed instead of using the disposable lab coats. This change would cost more initially, however, it would decrease costs over time due to not throwing away the lab coat after each use. Another way to help decrease costs would be to try and find cheaper vendors to buy supplies from. However, one negative aspect of this is when you buy things at a cheaper cost, sometimes the product will not be as effective as the thing that costs a little bit more money. When addressing the short staffing issues, Marshfield Clinic Health System could try and create a bonus or incentive for the staff members to refer others to come work for the health system. However, this would increase the cost of more personal protective equipment that would need to be used for more staff members. Additionally, the bonus or incentive would create another cost for the health system. Lastly, to help find a solution for the limited number of patients to be seen, the health system needs to hire more staff members. That is the only logical way that the dentist can see more patients. Therefore, the cost of personal protective equipment would increase, but the revenue for each dental clinic would also increase. Thank you.